As somebody in their 30s or 40s, we often come to a point in life where we do not know where we are headed, and if we do know where we are headed, we do not know if we are doing it the right way. That was the position that I was in when I enrolled for GMHE program at IIMB. I'm Dr. Archana Prabhakar. I'm a family physician practicing in Bangalore, and I have just shifted gears and moved into a role which is completely non-clinical. And this is to make sure that I know what I'm doing, and I'm now armed with this program from IIMB with my teachings and learnings from fantastic faculty at IIMB. One of the best things that could have happened to me during COVID, amidst the pandemic, where every other day I was in PPEs, working 10 to 12 hours a day, trying to do my best to make sure that my patients could come out of their miseries of being ill with COVID-19, was GMHE program. When I got the email that I had gotten through, I couldn't believe myself, but over a period of 1 year, I've come to realize that I'm now a much better person, a much better clinician, and I'm assuming that I'm going to be helping a lot more people in my new role, armed with all the learnings that I've had so far. Be it the very first session about communication, which Dr. Rakesh Godwani took, or the very last session of general commercial knowledge. Every session taught me things, made me think, made me read, things I wouldn't have done otherwise. It made me realize what I could be doing to change the scenario of healthcare in India. It has been a great experience. It's a great campus, fantastic faculty, and something I would love to do over and over again given the opportunity.
I am Diana Rajkumari from GMHE4. It was an absolutely fantastic opportunity to have been a thought partner in a multi-dimensional immersive experience at IIM Bangalore. The diversity brought by both the faculty and cohort in terms of experience, geographical network, and specialization included the voice of all stakeholders in the healthcare ecosystem. The patients, the doctors, the health tech entrepreneurs, the policy makers. So through concepts, case studies and discourse, we were able to live the lives of many healthcare leaders in the world, rural, urban and even in global setups. I look forward to putting the learnings to a more meaningful and bigger impact in the northeast of India. I invite you all to be part of this mission to change the landscape of healthcare in India from Indore to Imphal.
My name is Harathi Raghuram, and I belong to the General Management and Healthcare Education Program at IIM Bangalore, Batch 4. The healthcare sector is constantly evolving, and as administrators, it is important we equip ourselves with well-designed courses like the GMHE so we can adapt and align our hospitals to stay abreast in this VUCA world. The management program in healthcare education here has helped me gain a comprehensive understanding of the business dynamics of this industry, how to identify areas of need, allocation of resources, importance of organizational culture that drives the way care is delivered. The passionate professors here have designed the course with intense, challenging exercises that are thought-provoking and make us ready to take up more leadership roles. The contacts and network I built here during the course of this program will stay with me for life. GMHE has truly widened my horizons.
It's actually a feeling of being proud and a privilege to have been here to undertake the General Management Healthcare Program for healthcare executives here at IIM Bangalore. I'm a doctor by trade. I'm a surgeon, manage people. I'm a father, manage children. And I'm in the community managing people and interacting with them so as to serve them, so as to get benefits out of them. I think business is something that we are not taught as doctors. What GMHE has given me is a way of life. Managing deadlines, managing finances, having a strategy, creating a vision for your plans, and do things in a much more methodical, much more diligent way. A year and a half ago, I did not think that I would enrich myself with this knowledge. In addition to the knowledge, the interaction I've had with people, the connects I've had, and the fact that I've become a part of the greater IIM family, so to say. I would truly recommend the GMHE, the General Management for Healthcare Executives, if you are in the medical field, so as to augment your management skills, financial acumen, operational know-how, and to become a better clinician in addition to being business savvy. I certainly would recommend to one and all whether you want to be in the leadership position or not.
I'm Dr. Amrit Kadam. I'm Professor and Head of Radiation Oncology at Victoria Hospital, Bangalore Medical College. I've been managing my department for quite some time now, and actually during this time of COVID, crash course in kind of administration for me, trying to liaison with all the government officials also. As all of you are aware, at 40 plus of age, we all of us go through something known as midlife crisis, if I may say so. So that's when I realized that I need to look for avenues where I can learn all this administrative and managing things much better than what I'm doing presently. During COVID, I realized that there is a lot of scope for change, and I was looking for an opportunity where I could learn from this. So I looked at many things where I can do this kind of course. Then I squared it down to IIMB. So that's when I realized the plethora of experience all the staff have in IIMB. Coming to what did I learn from GMHE program, I think the way I am looking at things, even for example looking at just a simple note which my resident has made, or a sister comes with some request which has to be sent to our superintendent or to our higher ups or to the college director. Also, sometimes we may have to present some detailed project reports for our government proposals also. That's when I realized that the way I am doing it much before, it looks like what I was doing before was nothing when compared to what I am ready to do now. With all the tools, all these fantastic faculties have in place, and all the tools they have informed me now. So I'm a better person now, not just my work life. I think my personal life also has changed a lot. The way I interact with my close friends and otherwise also, and the way I talk to strangers also. So I think if you want to change your life and want to change the paradigm of your life, I think GM is the course to be to change your personal professional life.
I'm Rajvi Patel, and being a part of GMHE 5 has been a truly gratifying experience. The course content has been curated according to healthcare requirements. The ecosystem is explained so well by the faculty. They're extremely experienced, they have in-depth knowledge, and are pretty humble, accessible. In addition to them, the cohort that I have interacted with over here at IIMB has been very approachable. We have almost become friends, and I'm going to be taking back a treasure trove of information, knowledge, network, and a lot of friends to go. So I would like to thank IIMB for the opportunities. Thank you.